Are NSAIDs a risk factor for diverticulitis? Imagine your colon as a series of small pouches called diverticula. When these become inflamed or infected, it's known as diverticulitis. Now, you might wonder if certain medications can influence this condition. One group of drugs called nonsteroidal anti-inflammatory drugs, or NSAIDs, have been linked to an increased risk of developing diverticulitis and its complications. Research shows that regular use of NSAIDs, which includes medications like ibuprofen and Naproxen, can significantly raise the chances of experiencing diverticulitis. Large studies have found that people who take NSAIDs at least twice a week have about a 70% higher risk of developing diverticulitis compared to those who do not use these drugs regularly. The risk becomes even more serious when it comes to complicated diverticulitis, which involves perforation or bleeding. In fact, the risk of bleeding or perforation can be more than double for regular NSAID users. NSAIDs work by blocking certain enzymes in the body called cyclooxygenases. These enzymes help produce prostaglandins, which protect the lining of your stomach and intestines. When NSAIDs inhibit these enzymes, they reduce the protective prostaglandins, making the lining more vulnerable to injury. This can lead to erosion, ulcers, and even rupture of blood vessels within diverticula, increasing the chance of bleeding or infection. Studies also support that NSAID use is associated with a higher likelihood of diverticular bleeding and perforation. Meta-analyses, which combine data from multiple studies, show odds ratios around 2 to 3 times higher for these complications among NSAID users. Because of this evidence, health guidelines recommend avoiding NSAIDs, especially non-aspirin types, in people who have had diverticulitis or are at risk. If you have a history of diverticulitis, it's wise to discuss with your healthcare provider whether you should limit or avoid NSAID use. Sometimes, alternative pain medications can be safer options. Remember, every person's health situation is different, so it's important to get personalized advice. In summary, NSAIDs can impair the protective lining of your colon, making inflammation, bleeding, and perforation more likely. Being aware of this risk and working with your doctor can help you make safer choices and reduce the chances of complications related to diverticulitis.